Hello everyone, this is my very first attempt at recording a lecture, so I hope it goes okay. I just wanted to go through the slides for the joints because we skipped the types of joints during lectures, so I just go through it all together. So we'll start by looking at different ways to classify the joints. We're going to start by looking at functional classifications. And the functional classifications has to do with putting them into categories based on how movable they are. So if they are completely immovable, such as, for example, the joints between the cranium, so all of those sutures, those are immovable. They don't move around. They're called synarthrotic joints or synarthrosis. Synarthrosis would be the noun for that. And if they move slightly, for example, the joints between the vertebrae that are stacked on top of each other, they have a little disc of cartilage, so they allow for a little bit of movement. That slight movement would be called ambiarthrosis or ambiarthrotic joints. And if they move freely, so these would be any of the ones that we kind of think of like joints, elbows and knees, and moving the head around, the shoulder joints, all of those where they move all freely, those would be diarthrotic joints or diarthrosis. So those are based on classifications by the amount of movement. That's called the functional classification. Joints could also be classified by their structure. And when we say structure, we mostly mean what type of tissue binds them together. So for example, those sutures, the sutures are made up of dense fibrous connective tissue, and the dense fibrous connective tissue would be under the fibrous classification because they have fibrous connective tissue between them. And the cartilaginous ones have cartilage, either hyaline cartilage or usually things like fibrocartilage or elastic cartilage. For example, the vertebrae, that cartilage pad between them that makes them cartilaginous classification for that joint. And then we have synovial, and synovial, those are very complex with multiple different types of tissues, and those multiple different types of tissues just end up classifying them as synovial. Now, I did want to link the structural classifications with the functional classifications. So ones that are fibrous, those are going to be either synarthrotic or ambiarthrotic, not moving at all or moving partially. And the cartilaginous ones are also going to be either synarthrotic, meaning moving slightly, or ambiarthrotic, moving and not at all, or ambiarthrotic, moving slightly. Whereas the synovial ones, they're very complicated with multiple different types of tissues. Those are going to be classified as entirely diarthrotic. All synovial joints are diarthrotic, which means that they move freely. Now let's look into the anatomy of a synovial joint. Here we have two bones coming together. Here will be the epiphysis of a long bone and the epiphysis of another long bone. At the end of the epiphysis, at the end of the long bone, we have an articular cartilage. And the articular cartilage is going to be made up of hyaline cartilage. So the specific tissue type would be hyaline cartilage. And the name of the structure would be articular cartilage. Okay, so here's articular cartilage made up of hyaline cartilage. Then we have a capsule that surrounds the joint. And the capsule has several layers. It has an outer layer here, which is called the fibrous capsule. The fibrous capsule is made up of a dense fibrous connective tissue, makes it nice and tough. And then a very delicate inner lining, which is the synovial membrane. Okay, so we have dense irregular connective tissue making up the outside of the capsule, and then a synovial membrane on the inside of the capsule right here. And synovial membranes secrete synovial fluid that help lubricate the articulation so that as the bones are grinding past each other, it reduces some of the friction as they move through. So we have this cavity that's filled with a synovial fluid created by the synovial membrane that helps lubricate the joint to make it move more easily. We also have ligaments, and so if you look carefully on this picture right here, so in the darker pink, that's the fibrous capsule. The blue line would be the synovial membrane, but you see on this kind of purple structure on the outside, that's actually a ligament. And a ligament is made up of dense, regular connective tissue, and those are the structures that connect bones to other bones. By the way, a tendon is also made up of dense, regular connective tissue, but a tendon is different because a tendon connects bones to muscle. Ligament, bone to bone, tendon, bone to muscle. Okay, so we have these tendons that connect the bones together. Some of them are crossing. For example, if you've heard of the word ACL, that stands for anterior cruciate ligament. And what that does is it helps prevent hyperextension of the knee. In those synovial joints, we often have other structures called bursas. And bursas are just fluid-filled sacs that help cushion the ligaments. So for example, if you take your arm and you abduct it, which means you draw your arm away from the midline of your body, you might feel a pinch right there. If you have bursitis, it could mean that that bursa that's right here that pads the acromion from hitting into the greater tubercle, that bursa might become inflamed, and that's called bursitis. So bursitis is just inflammation of the bursa. And there's several treatments for this. Mostly you inject corticosteroids. You could also just take ibuprofen. Sometimes they suggest icing it to help reduce inflammation. And if it's bad enough, they can actually do some surgery. So that has to do with this bursa right here that can be pinched between the acromion of the scapula and the greater tubercle of the humerus. So remember, the function of a bursa is just to cushion at the joints. So there's lots of different types of synovial joints. I don't want you to memorize these types of synovial joints. I just want you to understand that you can get a lot of different types of movement in synovial joints. And all synovial joints are diathrotic, which means they are freely moving. Okay, so some examples would be like the ball and socket, that your shoulder can move in multiple different directions. We also have several hinge joints, for example, your elbow, which is the connection, the articulation between the ulna and the trochlea of the humerus. That creates a hinge joint in one plane. You have pivot joints. All of these are examples of synovial joints. So I put this picture on here to show you how many different examples of synovial joints there are. I do not want you to memorize any of these specifics. Okay, see you later.